In this video, we are going to see about the ulnar nerve in detail. So to have an overview of the nerve supply of the upper limb, which are all the branches from the brachial plexus, the main nerves that are distributing their supply are the axillary nerve, which supplies mainly the deltoid and the teres minor. The musculocutaneous nerve being the nerve of flexor compartment of the arm, supplying all the flexors of the arm. The median nerve, which is also a flexor compartment arm, supplying most of the muscles of the flexor compartment of the forearm or the flexors of the forearm except the flexor carpi ulnaris and the medial half of flexor digitorum profundus. So the median nerve also is known as laborer's nerve. Ulnar nerve, which is a branch of the medial cord, it supplies only two muscles, or we can say 1.5 muscle in the flexor compartment of the forearm, supplying the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. The ulnar nerve here in the hand has most of its supply, supplying to most of the intrinsic muscles of the hand except the thenar muscles and first and second lumbricals. So this ulnar nerve supplies the muscles which are mainly responsible for fine movements of the hands and the prehensile movements, that is grasping, holding a pen, holding a brush for the painting, and the muscles that are having fine movements for playing a music instrument. So this is called as musician's nerve. And the last is the radial nerve, which monopolizes the posterior compartment of the upper limb. So it innervates all the extensors of arm, forearm, and also the cutaneous sensations of the dorsal side of the hand, along with the median and the ulnar nerves. The ulnar nerve is formed in axilla related to the third part of the axillary artery as continuation of the medial cord of the brachial plexus, which has its root value from C8 and T1 roots, because C8 and T1 roots, they join to form the inferior trunk or the lower trunk, and which divides into the ventral and the dorsal divisions, wherein the ventral division continues as the medial cord, and in turn the ulnar nerve being the main branch or the continuation of the medial cord. But a point to be noted here is few of the fibers from C7 are carried along the lateral cord, then the lateral root of the median nerve, and by a communicating branch are communicated to the ulnar nerve, where the fibers of C7 supply only the flexor carpi ulnaris. So the root value of the ulnar nerve being C7, 8 and T1. The ulnar nerve, as told, is called as the musician's nerve because it supplies the most of the intrinsic muscles of the hand, which are involved in controlling fine movements of the fingers. Let's start seeing the course and relations of the ulnar nerve in various regions from axilla to hand. So in axilla, it arises in the lower part of the axilla related to the third part of the axillary artery. This here is the ulnar nerve. So this ulnar nerve courses between the axillary artery and the axillary vein, which conveys the fibers from C8 and T1, and it also receives its fibers from C7, which exclusively supply to the flexor carpi ulnaris in the forearm. In the axilla, the ulnar nerve, as it descends between the axillary artery and the axillary vein, it lies in little more posterior plane to the medial cutaneous nerve of forearm. So this is the picture of the cadaver. Here we can very clearly see this is the axillary artery. Lateral to it is the median nerve. Medial to the axillary artery is the ulnar nerve. More medial to that is the medial cutaneous nerve of forearm. The posterior most, this is the axillary artery, right? So this is the posterior cord, and this posterior continuation of the posterior cord is the radial nerve. So this being the ulnar nerve will be more posteriorly placed than the medial cutaneous nerve of forearm. In axilla, it does not give any muscular branches, but it does gives the vascular twigs to the related vessels, and that is the axillary artery and the axillary vein. So this is a more diagrammatic representation where we can see more clearly. So this is the pectoralis minor, which will be dividing the axillary artery into first part, second part and third part. This is where we are concerned with. So the third part of the axillary artery is related to all the branches, most of the branches of the brachial plexus. The second part of the axillary artery is related to the cords of the brachial plexus, like lateral cord is lateral to the axillary artery, medial cord is medial, and the posterior cord is posterior. So this medial cord continues as the ulnar nerve, and it also gives the branches like the medial cutaneous nerve of the forearm, the medial cutaneous nerve of the arm, medial pectoral nerve and medial root of the median nerve. So here the ulnar nerve is little on the posterior plane than the medial cutaneous nerve of the forearm, where both are related to the third part of the axillary artery between the axillary artery and the axillary vein. So its course and relations in the arm. It runs on the medial side of the brachial artery from here, from the lower border of the teres major. The axillary artery continues as brachial artery. So here this is the ulnar nerve. So this ulnar nerve courses along with the medial cutaneous nerve of forearm on to the medial side of the brachial artery up to the insertion of coracobrachialis, which roughly corresponds to the middle of the arm. So here in the middle of the arm, the ulnar nerve and the medial cutaneous nerve of forearm, they both separate from the brachial artery, while the medial cutaneous nerve of the arm, it pierces the deep fascia and becomes cutaneous, runs in front of the flexor compartment of the arm, whereas the ulnar nerve, it pierces, here you can see this is the ulnar nerve. So this ulnar nerve, it pierces the medial intermuscular septum. This is the medial intermuscular septum, along with the superior ulnar collateral artery, and enter into the posterior compartment of the arm, lying between the medial intermuscular septum and the medial head of the triceps, where the ulnar nerve along with the superior ulnar collateral artery rests on the medial head of the triceps. So roughly at the middle of the arm, there are so many events that are occurring. So here, as we're concerned with the ulnar nerve and the relations, one is the insertion of the coracobrachialis. Number 2 is the medial cutaneous nerve of forearm piercing the deep fascia and becoming cutaneous. Number 3 is the ulnar nerve piercing the medial intermuscular septum and entering into the posterior compartment of the arm. Number 4 is the origin roughly also corresponds to the middle of the arm of the superior ulnar collateral artery from the brachial artery. And then both of them, they descend, that is the superior ulnar collateral artery and the ulnar nerve, they descend down in the posterior compartment of the arm between the medial intermuscular septum and the medial head of the triceps and reach on to the posterior surface of the medial epicondyle. The one which is going posteriorly is the ulnar nerve. The one which is seen anterior to the medial epicondyle is the medial cutaneous nerve of the forearm. So it descends posterior to the medial epicondyle and the olecranian process of the humerus. Here also in the arm, there are no muscular branches that are given from the ulnar nerve, but it does give the vascular twigs to the brachial artery in the proximal part of the arm and then to the superior ulnar collateral artery, and it gives the articular twigs to the elbow joint as well. It scores at elbow. So here you can see this is the ulnar nerve. So this is the medial head of the triceps. This is the medial intermuscular septum. So it is lying between the medial intermuscular septum and the medial head of the triceps. In the posterior compartment, it is descending down. As it descends down at the elbow, it is related to the posterior surface of the medial epicondyle and the olecranian process. So posterior to the medial epicondyle, which is called as retrocondylar groove, there's a groove on the posterior aspect of the medial epicondyle here, where the ulnar nerve is resting in its groove. This is the medial epicondyle. So this is the ulnar nerve which is behind and is subcutaneous at this place, the ulnar nerve. So any irritation to the ulnar nerve being subcutaneous will cause tingling sensations. That is the reason the humerus has gained its name as funny bone. So here you can see this is the triceps, this is the medial head, this is the medial intermuscular septum, this is the ulnar nerve which is descending on the posterior compartment and posterior to the medial epicondyle. It enters into the forearm between the two heads of flexor carpi ulnaris. Because as the ulnar nerve descends behind the medial epicondyle, and as this region is related to plenty number of ligaments of the elbow joint and few of the muscles posteriorly, and as the nerve is directly resting on the posterior surface of the medial epicondyle, there forms an musculo-fibro-musculo-osseous tunnel which is called as cubital tunnel. Cubitus in Latin means elbow. So as the tunnel here is formed posteriorly, which gives a passageway, here you can see, to the ulnar nerve, that is called as cubital tunnel, where there is all possibility of the ulnar nerve being compressed in the cubital tunnel. So what is this cubital tunnel? As we said that it is a fibromusculo-osseous tunnel, the roof is formed by the flexor carpi ulnaris fascia, this one, which is between the two heads of flexor carpi ulnaris, that is the ulnar head of the flexor carpi ulnaris and the humeral head of the flexor carpi ulnaris are attached by a fibrous sheet. So this forms the roof, and this also, if it is little above superficially, just behind the medial epicondyle, there is a fibrous sheet that is connecting the medial fibril septum to the medial epicondyle, which is called as Osborne's fascia, this one. So this can also form the roof of the cubital tunnel. So here you can see this is the medial epicondyle, this is the olecranian process, these are the two heads of the flexor carpi ulnaris, and here is the fibrous sheath that is connecting the two heads of the flexor carpi ulnaris, and beneath which the ulnar nerve passes, and this forms the cubital tunnel. Coming to the floor, is formed by posterior and transverse bands of medial collateral ligaments and the elbow joint capsule, because it is directly resting over the posterior surface of the epicondyle. It directly rests on the elbow joint capsule also, as well as the posterior and transverse bands of the medial collateral ligament. And the walls are formed by the medial epicondyle and the olecranian process. So here this area forms the cubital tunnel. The cubital tunnel may be here just posterior to the medial epicondyle somewhere here, which is formed by Osborne's fascia as roof. So here you can see the ulnar nerve descending just behind the medial epicondyle and posterior aspect of the olecranian process, and coursing between the two heads of the ulna, and this is joined, the both heads are joined by a fibrous sheath which forms the cubital tunnel, into which the ulnar nerve descends as it enters into the front of the forearm. So something nice to know at the elbow region concerned to the ulnar nerve is the arcade of Struthers. So here you can very clearly see this is the ulnar nerve in the posterior compartment of the arm, which is between the medial intermuscular septum and the medial head of the triceps, resting over the medial head of the triceps. So there's a fibrous band you can see over here and here, which is connecting the medial intermuscular septum to the medial head of the triceps. This is an aponeurotic expansion, a fibrous sheath that is connecting these two structures. That is, in front is the medial intermuscular septum, behind is the medial head of the triceps. So that forms the arcade of Struthers, where it can cause compression of the ulnar nerve if there is fibrosis of this fascia or the arcade of Struthers or the Osborne's fascia. When we come down a bit, as the ulnar nerve descends down behind the medial epicondyle and is between the two heads of the flexor carpi ulnaris, the connective tissue that spans between the humeral and the ulnar heads of the flexor carpi ulnaris is located between the medial epicondyle and the olecranian process of the ulna, which is known as Osborne's band or Osborne's ligament, Osborne's arcade or arcuate ligament of Osborne's or cubital tunnel retinaculum, where the ulnar nerve can also get compressed, and this forms the cubital tunnel as well. And this is analogous or the similar to another variant muscle which is called as epitrochleoanconeus muscle, just like the Ganser muscle of the flexor pollicis longus in the flexor compartment of the forearm. This muscle is seen in the extensor compartment of the forearm, which is similar to the placement of the Osborne's band or the Osborne's ligament. So when Osborne's band or the ligament is there, the epitrochleoanconeus muscle may not be there. If the epitrochleoanconeus muscle is there, the Osborne's band, ligament or the arcade, all these are not present. So this is the area where this fibroaponeurotic fascia connecting the two heads of the flexor carpi ulnaris, underneath which the ulnar nerve traverses, forms the cubital tunnel and has all possibility of the ulnar nerve being compressed beneath this Osborne's band or ligament. So this muscular strip you can see here, this is the epitrochleoanconeus muscle, which is a very frequently noticed accessory muscle in the posterior compartment of the forearm, supposed to be one of the extensor muscles itself, and is supplied by the ulnar nerve. So the ulnar nerve goes beneath the anconeus epitrochlearis or the epitrochleoanconeus, which is in the same place as the Osborne's fascia, which is attached to the medial epicondyle and the posterior surface of the olecranian process. So here this epitrochleoanconeus, as it is taking origin from the posterior surface of the medial epicondyle, and it blends with the anconeus muscle, forming a cubital tunnel through which the ulnar nerve traverses and can get compressed during the flexion of the elbow. So this is the cadaveric picture. This forms the anconeus epitrochlearis muscle, an accessory muscle to the anconeus, and this is what is the arcade of Struthers. This is the medial intermuscular septum, medial head of the triceps. This is a fibrous band or the tissue traversing between these two structures, covering the ulnar nerve underneath that, where the ulnar nerve can get compressed behind or beneath the arcade of Struthers as well. There is another one which is related to the Struthers, is ligament of Struthers, which is related to the median nerve. So that ligament of Struthers compresses the median nerve and arcade of Struthers compresses the ulnar nerve.